Good evening. Namaskaram. My name is Dr. Jag Anand, and today we're going to talk about COVID. Before we discuss COVID, I'm going to discuss few basic concepts with the audience and the viewers. First is R number. What is R number? R number, you will read any article on COVID in the newspaper. They are mentioning two things, R number and herd immunity. R number is how many people get infected from one person who has COVID. Usually it's 3 people. And for certain diseases like mumps and measles, the R number could be 15, means one person can infect 15 people. So ideally we would like the R number to be below 1 so that we can flatten the curve and we can control the pandemic. So that is the R number. Presently in Alberta, the R number is varying between 1.2 to 1.3. That is the hypothesis from the epidemiologists. And the second concept is herd immunity. Herd immunity is that how many people of the general population have antibodies against the virus. So you get antibodies by two means. If you get infected from COVID virus, you get the antibodies. Or if you get vaccinated, you get antibodies. We would prefer the herd immunity through the route of vaccination. Now we're going to come to different types of vaccines available in Canada. Presently we have 4 vaccines cleared by Health Canada. Number 1 is Pfizer-BioNTech. Second vaccine is Moderna. They are both mRNA based vaccines. And the third vaccine is AstraZeneca from Oxford. And fourth one is Johnson & Johnson, which is a DNA-based vaccine. It's cleared by Health Canada, but it's not available at the moment in Canada, but we believe we will be getting it towards the end of April. So I will briefly discuss every single vaccine available in Canada. First one is Pfizer-BioNTech. This is a messenger RNA-based vaccine. So there are parts of the virus called spike proteins. They are like little tentacles. They attach to the human cells when they enter our body. And mRNA vaccine has produced these spike protein, and then we inject them in the body, and the body mounts an immune response. mRNA vaccines are very fragile, and that's the reason the freezing dry ice and minus 70 degrees centigrade for Pfizer vaccine. The other vaccine, Moderna, can be stored at minus 20, minus 30 degrees centigrade, and it is coated with a special liposomal nanoparticle which prevents the fragile mRNA from disintegrating. And the advantage of AstraZeneca Oxford vaccine is that it is refrigeration is much easier. And the fourth one is the DNA based vaccine, which is Johnson & Johnson. And the main advantage of that vaccine is one single shot and you're done. And it will be great for far off areas and for poorer countries where there is problem with transportation. Now there has been a lot of confusion in the media, in the social media, and amongst general public about hesitancy to get vaccine. And the second thing is, which one is better? Let me put it this way. Every single vaccine which is available in Canada has had thorough study and clearance from Health Canada. There is a rider with AstraZeneca that it is not for people under the age of 55 because of a very rare side effect which has come to light. And it is a blood clot in a venous channel in the brain. It's called venous sinus thrombosis. The incidence previously we thought was 1 in 500,000. And now there is a talk it could be between 1 in 100,000 to 1 in 250,000. Still, it is a very, very low incidence. And in the age group and under the criteria where it is recommended, it is very safe. And Nothing is completely safe. Even aspirin is not safe for people who are allergic to aspirin, and they can have severe anaphylaxis reaction. I urge all our friends and viewers to go and get vaccinated, because that is how we're going to achieve herd immunity. Ask your family doctor, ask your health experts, ask your pharmacist, and don't be confused by all the fake news on the social media. Look at it this way: if you're healthy and you don't get vaccinated and you get COVID, you could transmit it to your older parents, and they could be seriously sick, and they can get hospitalized. So that is the situation we would like to avoid. Now with the variants, you have UK variant and different types, South African variants, Brazilian variant. They are more contagious and more infective. So what that means is that if one person who had the normal previous strain of coronavirus or COVID was going to infect 10 people, this strain, which is the UK strain or Brazilian strain or South African strain, hypothetically could say infect 50% more people. Like instead of 10, it could infect 15. And the reason behind is that these variants of concern or variants of COVID, they have the spikes in the dome, they get attached more firmly to the cells in our respiratory passages when they enter the body. So that is the reason there's possibly we're already in the third wave, and as we have heard, there is lockdown in parts of Quebec and in Ontario, and hopefully we won't have this situation in Alberta. And I urge all of you to please go and get vaccinated. Alberta has 30% of people saying vaccine hesitant, that they are scared or they don't want to be vaccinated. The national average, I believe, is about 12 to 18%. So we need to educate the community that this vaccine is safe. If it was not safe, Health Canada wouldn't have allowed it to be, brought out in the market. And the other good thing is the reactions from this vaccine are very, very rare. You can have a local reaction, which could be pain, swelling, tenderness at the site, or you can have a little fever or myalgia or muscle ache. The serious side effects, as you have noted in my previous segment, like venous thrombosis, is only reported with AstraZeneca, and it's very rare, 1 in 200 to 1 in 500,000. Even 1 in 100,000 is very low, and that is only if you follow all the guidelines. The chances of that are even more slim. The other request I have is, even if you get vaccinated, we still have to take all the precautions for social distancing, masking, and frequent hand washing until we achieve the herd immunity, which is around 70% for this virus. We will not be able to control this pandemic. So it's very important that we all follow the guidelines set by the health experts of the province and by the federal government, and listen to our healthcare providers, listen to our family doctors, listen to our pharmacists, and take care of each other. And like in our community, in people of color and in people of South Asian community, there has been a higher incidence of COVID, because we are frontline workers. We go out of the house to work. We are transit drivers, we drive a taxi, we are healthcare providers, healthcare aides, nurses, we work in the meat plant. The virus doesn't differentiate. Race is not a risk factor, but racism is. Thank you very much.